Good morning one and all, and welcome to my YouTube channel, Dr. Anwar's Educational YouTube channel. It is a non-profit, non-commercial, free educational YouTube channel where I am uploading the various videos, animations of various subjects totally free to the students, and also conducting the free webinars on various topics. So today we are having the most awaited and most requested webinar, strategies for the preparation of the GPAT and other competitive examinations. For this webinar, we are having the speaker, Mr. Kaustubh Pawar, who is All India Rank 2 for these GPAT examinations, who cracked this examination in 2018. So let me introduce Mr. Kaustubh Pawar first. Mr. Kaustubh Pawar is a proud son of Dr. Atmaram Pawar sir, who is a well-known personality in the pharma field. Mr. Kaustubh is currently pursuing M.Pharm at Institute of Chemical Technology, Mumbai. His major achievements includes secured All India Rank 2 in Graduate Pharmacy Aptitude Test GPAT 2020, ranked amongst top 5 throughout the B.Pharm at Savitribai Phule Pune University, first ranker among all years of graduation at MIT Institute of Pharmacy Pune, and he is honored as the best outgoing student at MIT Institute of Pharmacy Pune. Worked as a joint secretary in Indian Pharmaceutical Association Student Forum 2015 to 16. So his journey of achievement and success is not stopped at that place. Currently his M.Pharm result are he secured 9.33 and 9.67 respectively out of 10 in a SGPA scale of his SEM 1 and SEM 2 of master program. So with brief introduction, I would request Mr. Kaustubh to continue with the session.
So, very good morning all. And it was a lovely introduction. Thank you, Dr. Anwar Sheikh, for calling me on this stage so I can share my knowledge and insights, whatever I gained throughout the journey of preparing GPAT and other competitive exams. So, let's start. So today we are going to see various preparation strategies for GPAT and other competitive exams. I am very delighted for such a lovely response. About 6,000 registrations were there and they are growing minute to minute. So rather than waiting, we will start with our presentation. So first question is, why do you want to do it? It's a tough job to crack the GPAT, but it's easy and very interesting. So for that, you have to answer a question. What's the motivation behind pursuing the GPAT or any other competitive exam? Because this is the most important aspect, and which is everyone neglect that, because if you don't have a strong motivation, then it becomes very difficult throughout the journey to sustain, to study for 1.5 years, to accumulate all the knowledge throughout the 4 years and then attempt that GPAT or any other competitive exam. So I will tell you an interesting story. Actually, what motivated me to get an All India rank. So actually, when I poorly performed in my 12th boards, I was very disappointed. I let my family down. So that was the factor, or that was the motivation for me to perform very well in the GPAT exam as well as in my pharmacy graduation period. And that always motivated me and sustained me throughout the journey, and which motivated me to perform the hard work for dedication, and ultimately I was All India rank. So before starting your journey, you have to decide what's your goal, what's your target for appearing the GPAT or any other competitive exam. Whether you want to get an All India rank or only you want to qualify. Because if your goal is to only qualify, then you might or might not. But if your goal is to get an All India rank, then you will definitely qualify with a good marks. And so my goal was to score about 300. Why it is so? Actually, till 2017, I did a survey, and overall, and on an average, 260 was the highest score which an All India ranker got. So I decided, why not to keep a score of above 300? Then eventually, if I get above 300, I will become All India ranker. So that was my goal. to get an above 300 score, not an all India rank, but to break the records. So as I always believe, if you aim a gold medal, then you will land up with a silver. And if you want to get a gold, then you have to aim for a world record. So starting with this philosophy, I think we all should pursue anything in our life. Then let's see how to prepare. So first of all, as we all know, there are 20 subjects in our syllabus, and each and every competitive exam, whether it be GPAT, Manipal, BITS, JSS, Bharati Vidyapit, all have the same syllabus. There is no much difference, except for NIPER entrance exam, they add few more subjects like mental aptitude and pharmacy general knowledge. So they are not much tricky. Just you have to read the everyday pharma newses and practice the mental aptitude. Rest about this, everything is similar and same for all the competitive exams. So why to worry? So here is a tricky question, whether you want to be a jack of all or you want to master most, because it's very difficult to study each and every subject of the GPAT. There are 20 subjects. It's a tough job. But if you concentrate on the stronghold of your subjects, which you like, which you love to read, which you are good at, so you practice those questions, you take the knowledge, you practice the skills of solving those questions. Then eventually, if you can master most of the subjects, giving my personal example, for me, pathophysiology was a difficult subject. So rather than focusing on that, I focused on the rest 19 subjects. I am good at SUTEX, I was good at analysis, pathology, medicinal chemistry. So I mastered those subjects, and ultimately I got 318 score by God's grace, and that is the still today second highest score in a GPAT history. So that's why I will always tell, master most of the subjects, master most of the topics from the GPAT syllabus. And whenever you solve this question, be sure that it will be correct. Then how to start? So we will start with basics. Every time, foundation is much more important than the later stages of the building. So starts with basics. The subjects which you are studying in first year and second year are most important for your future life, because this will affect your medicinal chemistry, ecology, SUTEX knowledge. As you can see, physical chemistry, organic chemistry, biochemistry, these all are subjects which are taught in first year and second year. So if you are a student of first year, second year, start preparing from right now, so that it will be very easy in the later stage. So you can grasp the knowledge of these basic subjects of HAP, pathophysiology. Later it will be very easy for you to understand the ecology and clinical pharmacy. So why not to start with basics? So I will always tell, start with basics, all the subject chapters which are given in the GPAT syllabus or else in your semester syllabus. Go with it. And after completing your basics, move to the major subjects which are the core of pharmacy, like pharmaceutics is there, analysis is there, medicinal chemistry, pharmacology. So whenever you will be thorough with your basics, it will be very easy for you to grasp the major subjects and to master it. There are various allied subjects also, like jurisprudence, management. These are also important from a perspective, because from each and every subject, at least there are 2 to 3 questions. Actually, in total, there are 125 questions in a GPAT and 200 questions in NIPER. So from each and every question, every subject, there will be few questions. So if you master each and every subject or most of them, I am sure you will be able to solve most of the questions and easily qualify the GPAT exam. And why I'm saying this? Because go step by step. Now, if you can see, a heterocyclic ring, name reactions and synthesis, which are taught in first year of organic chemistry, they are interlinked with the structure, SAR and synthesis of actual drugs which are taught in medicinal chemistry. For an example, the Panam ring, which is a heterocyclic ring which is present in penicillin. So if you know the name of a heterocyclic ring, which is a Panam of penicillin, then you will easily understand the structure and its SAR properties of penicillin, and you will be easily able to synthesize that product. So that's why focus on basics, which will give a lead on the major subjects. Another example, now if you can see colloids, which is taught in PP, there are various surfactants like twin, span, and that surfactants are used to prepare a dosage form, which are emulsions and novel drug delivery system. So if you know that colloids, which colloid, now for example, if it is a span is a lipophilic colloid, and twin, which is a hydrophilic surfactant. So why span is used to prepare W by O emulsion, and why twin is used to prepare O by W emulsion? If you can understand this aspect, then it's very easy to qualify and attempt the GPAT problems. For interesting example, there is a concept of span. Now spans are monosteroids. Now steroids are lipophilic in nature. As they are lipophilic, as it is made up of monosteroids, it is very easy to prepare W by O emulsion, and its other aspect is of twin, as twin contains the polyoxyethylenes of monosteroids. As we add more and more OH groups, polyoxyethylene groups, it will become hydrophilic. So as it becomes hydrophilic, we can use that surfactant to prepare O by W emulsion. So this is the way which you should read, which you should accumulate your knowledge, which you should learn, rather than mugging up like span, twin are used for O by W. Try to learn the concepts, try to learn what's the philosophy, what's the concept behind that. Then it will be very easy to remember and to solve the questions. For example, if you know the diseases which are in HAP and pathophysiology, then you will be able to understand what's the mechanism of action of a drug. Then if you understand the mechanism of action of a drug, then you will be able to understand why it is used, what are its drug ADR, what is its clinical therapeutic value. So that's why it's everything in our pharmacy is interlinked, starting from the first year to the final year. Each and every subject is interlinked. Now, if you can say, if you can take a case of biopharmaceutics, we have to calculate volume of distribution, release kinetics of a drug, then clearance. Now, what are the basis of this biopharmaceutics? That lies in the PP, where we learn kinetics, first order kinetics, second order kinetics. It lies in the dosage form. Which dosage form? Now, it is an injection or it is an oral solid. Both injections and oral solid will have different compartment model. And as well as when you will read this along with the ADME, that is absorption, distribution, metabolism, and excretion of ecology. When you will have all the three subjects topics knowledge, then it will be very easy to understand the biopharmaceutics. So that's why go step by step rather than jumping directly into the major topics, directly taking up biopharmaceutics. Start with the PP and try to correlate those topics with the major topics. And it's very easy when you do these things to crack any competitive exam. Then the next most important question in every student's mind is how to manage our time. We have semester, we have to sleep, we have to enjoy, and apart from then there is a time where we can study for a GPAT or any other competitive exam. So I will say, बेटा sacrifice करना पड़ता है कुछ भी achieve करने के लिए. इतना भी नहीं, just if you can spare 2 to 3 hours of daily preparation for GPAT, it's more than enough. Generally, it requires 1 year of time for preparation of any competitive exam. I will always prefer to start from 3rd year. So those students who are in 3rd year, please start from right now, because you have time and you can prepare it well. Usually for minor subjects, which I told in previous slides, requires 5 months and 5 to 6 months for major subjects. And then rest in November, December and January, you can start revising and solving the problems. So if you follow this, it will be very easy for you to crack the GPAT, and you will have ample of time to cover each and every subject of the syllabus. As you can see, in a time management of second point, I have mentioned how much weeks you should allot for a subject. Now, what happens? Students take up a topic like PP, and they keep on reading for a month. It's actually a waste of time. For a PP or for any minor exam, you should allot only 1 to 2 weeks. It's more than enough. You can easily cover each and every topic of a PP or a micro or a biochem in 1 to 2 weeks. Now, what you have to learn, what you have to read, That is the key aspect here. You don't have to read everything, each and every line, but the bulletin points, which I will tell you in the further slides. And approximately 1 month, 3 to 4 months is enough for studying entire ecology or any major subject. Now, when this is possible, when you will be clear with your basics and when you will be able to correlate those concepts with the actual concepts of pharmacy, then this is possible. So what's the technique which I used? This is the most interesting aspect of the journey, because sometimes like every individual has a different technique to study. Now what I used to take a topic, if example it is a colloids or example it is a kinetics. Then I used to study that topic. I used to mark and make a notes of each and every bulletin points, only important points. If there is a formula, if it is correlated to something, those are the important points that I have to note it. And then I used to go and discuss with my friends. I used to explain those topics with to my friends. So let's see, when you discuss, when you explain that concept to your friends, it very much easy to remember. If you remember the pyramid of remembering things, if you read, you only remember 10%. If you read and write, you remember about 20%. If you read and write and speak, you remember 30 to 40%. If you read and write and discuss, it goes on to 60%. And ultimately, when you explain, it is around 70% things or the concepts you will remember. And ultimately, when you practice those concepts, it will be a 90% retention. So I always tell to all my fellow students that go and explain those concepts to your family, to your friends, teach those subjects, because as you can see, teacher knows those concepts because they each and every day explain those concepts in simple words to their students, and that's why they are able to retain all those aspects. So go and explain, go and teach to your fellow students, fellow friends. And after doing this, the most essential part is solving the questions, solving previous year questions. There are n number of books from which you can solve questions, and practice is the most essential. As we say, practice makes man perfect, and that's true. I personally practice 2000 questions of each and every subject. There are various number of books. I started with Inamdar, Muhammad Ali, Pearson, Piyush. Then there are various test series. As Sir said, there is a Maimu mock test. There are various applications which are available. So go and practice those questions. When you will practice, you will know how questions are formed, how you can tackle those questions, what will be the correct answer and what will be the incorrect answer, how to solve those questions. This idea you will get only when you will solve the questions. Most of students says me that when you solve a question, you might get wrong, and then after that they goes into disappointment. Why to go into disappointment? If your answer is wrong and if you're correct next time, you will read much and more on the topic, and then it will be easily remembered. So tackle the elephant in the room. As we say, tackle the toughest problem. So go and solve as many questions as possible. The next point is, and it's the each and every student asks me this question, whether to take notes while studying or not. I personally feel it differs from person to person. Few students can remember those topics by learning, or few people can take notes. Now, while taking notes, the tricky point is you have to take notes of the bulletin points. You don't have to write like a semester paper exam, all the theory, each and every word. It's utterly nonsense. You have to make bulletin points, and that's the key for cracking any competitive exam. And I usually prefer to make notes, because at the end of revision, at the last point, in those 2 to 3 months of November and December, your notes will be handy, will come in handy, and that's which is going to save you from the GPAT. Now let's see how to take notes. These are a few pictures of my notes which I have taken. So like see, in the first picture, you can see the heterocyclic synthesis. In this, I have just mentioned the reactant, then the catalyst, and then the product. Like this, you have to take notes. Rather than writing each and every step of the reaction, just mention the reactant, catalyst, and the end product. and make a table like this, or make a chart like this of each and every reaction, and then keep on practicing it. It will be very easy to remember these name reactions. In the second figure, you can see this is the figure where I have literally mentioned each and every formula from biopharmaceutics, like how to calculate T half value, how to calculate volume of distribution, how to calculate clearance. There are different renal clearance equations which are used at various different aspects. So everything is mentioned in one picture. So like this, you can revise each and every topic just in a go. So this is the how you prepare notes for your any competitive exam, and not like you write a semester paper. Few other examples are like you have to remember the IR values and NMR values for your GPAT. So like rather than remembering IR values, I just plot a line graph of those values and mention each and value, like carbonyl ka kahan aata hai, like saturated ka kahan aata hai, like it is 2800 for CH, above 300 for C triple bond C. So if you can visualize like this, and it will be very easy to remember, much more easy to remember all the theoretical values like ecology, cognosy, then values, then limits, evaluation test. If you can draw like this, if you can draw a mind map, if you can draw a diagram out of it, then it will be very easy to remember those aspects. Like let's take an example of cognosy. As we all know, cognosy is very dry subject. Literally you have to remember those aspects. So rather than just reading it from the book, make a table. Here I have made a table of stomata. As you can see, parasitic has a parasitic stomata is present in senna, coca, whereas diacitic stomata is present in peppermint, spearmint, vasaka. So if you have a list of these subjects, list of these topics, then it will be very easy for you to remember, and it will be very easy at the time of GPAT exam, because the question will be like that: which stomata is present in belladonna? There are 5 types of stomata. So are you going to recollect everything? It will be very easy if you can correlate like this: anisocytic in belladonna, datura and vinca, because every solanus family has a, or tropane alkaloid has an anisocytic stomata. Like this, you have to revise, you have to study. Then after making notes, there are various tricks and mnemonics which I use to prepare. Now, as you can see in this figure, this is a post from my Instagram page of Pharmacoscopy, where I guide students, and as well as post various topics and various key factors which are essential to crack any competitive exam. As you can see in this figure, in first figure I have mentioned mnemonics for tetracycline adverse effects. As you can remember, Kapil Dev. We all know Kapil Dev. So Kapil Dev is equal to mnemonic of a tetracycline. Like this, it will be very easy to remember. Now K stands for kidney failure. A stands for anabolic effect. Like that, P stands for photosensitivity, I for diabetes insipidus. So if you can remember the mnemonic, so at the time of exam, if the question is what are the adverse effects of tetracycline, there will be various options, like there will be kidney failure, renal failure, CVS toxicity, as well as CNS toxicity. From these 4, which one is correct? It is a kidney failure, because K stands for kidney failure. So at that time, you will be able to recollect that mnemonic, and when you will recollect that mnemonic, it will be very easy to mark the correct answer. Now in second figure, as you can see, I used to make the charts for various drug of choices or various ADRs or limits or evaluation tests. So as you can see it here, there is a chart of absent seizures and its drug of choice. As we can see, valproate is a drug of choice for at least 6 various types of seizures. Similarly goes with carbamazepine, ACTH. So if you can draw like this, if you can make these charts, it will be very easy to remember those points. Then the next the next question which every student asks: how to manage semester as well as GPAT? Both we have to study, both we have to pass, both we have to qualify. Semester will give us a degree, whereas competitive exams like GPAT will give us an admission in a college. This is the case. It's same like a 12th. We have to prepare for CET, JEE, we have to prepare for our boards also. Now, in both the cases, the same syllabus is same. What you will read in a semester, that is going to be asked in GPAT. Try to read it twice. Read in a single stroke for semester as well as for GPAT. While you are preparing for semester, the difference and the key factor is in semester you have to learn it theoretically. You have to write a long answers. While in GPAT there will be applied questions. So how to learn for those applied questions? How to make notes for those applied questions? So if you will solve as much as possible, you will get to know how the questions are asked. For example, in GPAT, it will be what will be the drug of choice for methicillin-resistant staphylococcus infection. Whereas in semester, it will be write a pharmacology of penicillin. So like this, there will be the questions. So while reading for penicillin, by reading for its analog, just mark the important points like drug of choice, like ADR, like its metabolism effects. Similarly, as we can see, which heterocyclic ring is present in penicillin. These questions will be asked, like these questions will be asked in GPAT or any other competitive exam, and this will be a PANAM ring. So if you can see, the PANAM is taught in our organic chemistry, which is a heterocyclic ring, and that is correlated with the medicinal chemistry and its structural activity relations. So if you can correlate these topics, it's great. Then similarly, as I told, twin is used for preparing O by W emulsions. So if you can correlate these topics, it will be very useful for you. Then right now we saw why to study, how to study. Now let's see what to study. And it's like most important aspect of this journey, because most of the students try to read each and every point like the semester exam, but it's very opposite in the case of competitive exams, where you have to remember only bulletin points and important concepts. Rather than mugging up, just understand those concepts, study smart, do hard work, but study smart. Like example, in ecology, they will be asked classification, which drug belongs to which class. So rather, you have to just remember the classification. If you remember the classification, you will be easily remember its drug of choice. If you can remember a structure, it will be very easy to remember the synthesis pattern. Similarly, in NMR, each and every year there will be a question of NMR numerical as well as IR ranges. So as you can see, the concepts and the topics are like almost 20 to 30% repeated each and every year. So if we can narrow down which topics are repeated every year and study those, I am sure you will easily qualify those subjects and get an All India rank. So as you can see, each and every year they ask a sterilization technique. They will ask a different technique, but there will be a sterilization technique. Each and every year there will be a schedule. Now in schedule Y is most favorite of them, because schedule Y, now here it is strict. There are two parameters for schedule Y. Schedule Y is associated with the clinical trials as well as for the import guidelines. So both the in-depth, you have to learn in depth rather than learning superficial as you learn for any semester exam. Here the trick is that you have to learn very few topics, but those in depth. So if you can do so, then it's very easy to crack an exam. Then the next second point is study similar topics together. As you can see, throughout those 20 subjects, you have various topics overlaid in various other subjects. For example, colloids, which we study in PP. In that we study surfactants, its properties, HLB scale, and the same is given in suspension and emulsions of Sutix, and the same is given in dispensing pharmacy. So if you can study that topic together, you will be able to complete each and every topic from each and every subject. So in a go, and it will save you a time. Similarly, another example is carbohydrates and amino acids. That topic is present in organic chemistry, cognosy, as well as biochemistry. So study that points together. So you will be able to complete all the three subjects. And the most important point is always study ecology and medicinal chemistry together, because you have to study pharmacology properties of a drug and its structure and synthesis. So do simultaneous study of ecology and cognition. If you take an example of penicillin, tetracycline, study its pharmacology as well as study its SAR. In a one go, you will be able to complete both ecology and medicinal chemistry, and that will save you a time. So always practice such techniques. So I told you two techniques. First one, study a topic, discuss, explain this topic to your friends, and then practice the questions. And the second is, whenever you will study, first point out which are the overlaying topics, study those topics together, so you will be able to complete various topics of the various subjects in a go. And the third is most important, solve previous year questions paper. There are various books, and the most favorite book is of Inamdar, because in that each and every year question paper is given. So if you can analyze each and every year question paper, you will get to know which are the most relevant topics, which are the most favorite topics of the examiner to ask those. So if you can shortlist those topics, it will be very easy to learn and very easy to practice those problems. Then moving to which are the important or the weightage granted for the physics, ecology, medicinal chemistry. Right now, till 2018, each and every subject was mixed up. But from 2019, they have segregated each and every topic. Like for physics, there will be a 20 to 25 questions. For ecology, there will be some questions. For cognition analysis and medicinal chemistry, like this. So if you can grasp those questions, if you are good with physics, then practice physics. So you will be able to correctly solve 20 to 25% questions like those. If you are very poor in cognition, don't worry. At least 85% of the questions you will be able to solve if you are good in other subjects. And the topics which I have highlighted, like pharmaceutics, physical pharmacy, microbiology, biopharm, ecology, clinical pharmacy, medicinal chemistry, organic chemistry, pharmaceutical analysis, and pharmacognosy. Each and every year from these topics, questions will be there. And around 40% questions will be from these topics only. So if you can study these subjects very properly, it will be very easy to score a good marks. So try to understand what is the weightage for each and every subject. Then let's see for final year students. Now those who are going to appear for 2021 exam and they are thinking of starting from July. After hearing this session, if they are planning to start for a GPAT, don't worry, you are not too late. Still you have 6 months in your hand, and it's more than enough to qualify with a good marks. Just study for 5 months and then revise everything which I have studied in the last month of December. So now in this case, rather than reading each and every topic of the syllabus, focus on the important topics which I have mentioned, like ecology, classification, mechanism of action, DOC and ADR are the most favorite points from where you will get questions. And for this, there is a Sparshan Gupta book, there is a Rangandel. So from Rangandel, always refer tables and the mnemonics which they have given. It will be very handy. Likewise, for medicinal chemistry, you can study SAR, structure, synthesis. So the topics which I have highlighted, which are in red, they are most favorite topics, and those topics should be revised by a final year student in this session. So as you can take a screenshot of this slide, so it will be very easy while preparing. Then moving to next minor subjects. From minor subjects also, the schedules from jurisprudence. Each and every year there will be 1 and 2 questions from schedules. There will be 1 and 2 questions from calculations of either for biopharmaceutics or either dispensing pharmacy. There will be a question of allocation method. There will be a question of cycles. There will be a question of heterocyclic, UPAC name reaction. So like this you can see. This data I have assimilated after solving each and every year's question paper. After analyzing each and every question paper, I have shortlisted these topics which are most favorite of a examiner. So they will definitely ask a question. Around 40% questions will be from these topics. So if you will study these topics, I am sure you will get a good marks. For qualifying, just you require 40 questions correct. You require 160 marks. And for getting an All India rank, if you require a 300 score, which is approximately 60%. For getting a rank in a university exam, you require around 80%. Whereas in getting All India rank in GPAT, you require only 60%. So you will know what is much more easy, a GPAT or a semester exam. Then let's see which books I prefer. Now you can see Indian Pharmacopoeia and USP. They're the most important books which a student should read. But students try to neglect those because why they are important. Now you can see the limits, evaluation tests, the criteria for any sterilization technique. Each and every aspect is given in Indian Pharmacopoeia as well as USP. And from these books only the questions will be asked. So try to learn and remember limits, evaluations from these books rather than referring any other book. For physical pharmacy, refer Martin. It is a standard book. For pharmaceutics, Alton is there, Lackman is there. For biopharmaceutics, Brahmankar is there. And always study ICH guidelines. Nowadays, since 2018 or 17, they are asking each and every year one ICH guideline. Either it will be a Q, M, it will be a one guideline they will ask. So these are the important points. For pharmacology, you can refer K.D. Tripathi, Rang and Dales, Persh Gupta. For classification, there is a separate book called as Vikas Set. Then for medicinal chemistry, there is Foes, Wilson. And most favorite book of each and every student is Pearson, which is very easy to read because they have given the bulletin points and every important point is mentioned on in that book. So refer that book for revision rather than reading topics from those. Try to learn concept from the standard books, and after learning the concept for revision at the end of 2 to 3 months, refer Pearson. That will help you. And for question papers, you can refer Inamdar, you can refer Muhammad Ali, then there is a Pearson, there is Piyush, then there are various test series. Each and every class, GPAT class or coaching class is conducting test series. There are national level quizzes. So try to attempt those quizzes, because when you will attempt a quiz, it will revise and brush up each and every aspect, concept of the syllabus. So this was what I wanted to tell you. And at the end of this session, the philosophy of the dialogue which I always like is of 3 idiots. Success के पीछे मत भागो, excellence के पीछा करो, success जप मार के तुम्हारे पीछे आएगा. And that's true. I never attempted or never wished for All India rank. My goal was that, but my aim or my theory or my philosophy was to get excellent throughout the syllabus, throughout the graduation of my BPharm. So if you get excellent in what you do, ultimately you will get your success. So that's all which I wanted to share, the insights and the knowledge which I gained throughout the 4 years. And I hope you all enjoyed this session. Thank you.
Thank you, Kaustubh. Am I audible?
Yes, sir.
Yeah, thank you. So it was a very nice and wonderful session, and you explored all the details about and made it more easy. And you told
you.
that 6 months is more than sufficient if you properly plan your work.
Right.
So now the session is open for the question. Before that, there is important announcement that at the end of this question and answer session, we will be conducting 5 MCQ test. Only 5 MCQ will be there, and those MCQ will be based on whatever the hints, name of the books, tricks he has given in this webinar. Those first 3 very quick responses, it will be based only on 2 minutes. 5 MCQ will be there, and those first very quick responses, 100% correct answers will be given 1 year's free online test series. The test series will be comprising us of the GPAT and MPSC, and there will be total 100 tests will be given to you, as well as the study material and handy notes. Those who will be attempting more than 70% of these answers, they will be given study material, handy notes, and they will also be given a one-time access to view this webinar. Okay, so the session is open for questions. So very few questions will be attempted. So write down any question you want to write. You want to know something about from this session. This session will not be available as recorded on YouTube channel. It will be only available to those who are attempting the test at the end of the session. So write down the question. Can you please refer some apps for GPAT preparation?
So, okay. So right now there are no much apps, but there are various YouTube and Instagram channels. Like this channel where you are viewing it live. So there are many GDC channel, then Dr. Anvarshak's channel, or there are various MyBo test series, or various Instagram page like Pharmoscopy is there. So you can refer those pages for quick revision and for understanding better knowledge. Yet there is an app which is coming, and I hope it will come soon, which will be very easy and helpful for you for preparing any GPAT. As such, now there is no such any app which I can suggest you, but I can suggest you the YouTube channels and Instagram pages.
So thank you, Kaustubh, for this great session and sharing all the details and his techniques and tricks what you utilize for your examination preparation. And I hope student will be utilizing these tricks, following these tricks, the guidelines he has given to us. And definitely you will also be cracking this examination. And not only this examination, the examination related to the pharmacy online examination and other competitive examinations, as the preparation strategies are quite similar. I am very much thankful to the Kaustubh. I am also thankful to the Atmaram Pawar sir. I am also thankful to all the principals, teachers, students who contributed in making this program most successful, because 6,500 registrations has been crossed and lot of you are online. I am also thankful to the group admins who supported in spreading this message. So thanks again, and we will be coming up for the new excited webinars. So always subscribe this channel and regularly visit this channel. You will be getting all the videos and webinars, recorded webinars. Very shortly I will be uploading this recorded webinar on my YouTube channel also. So thanks again.